the last day of the last working day of the first week of June. Before you know it, once we enter second week like this, just now June has finished. But yeah, you're very welcome to Women Radio 91.7 FM, and this is Radio Doctor, your free health consultation program where we bring on doctors to consult for free, with us on different issues, health issues that are plaguing us. We are live on YouTube at WFM 917, and you can listen to us on the go via our website, www.wfm917.com. Also, you can call us, excuse me, but before the phone lines are open, you can send your text messages or WhatsApp messages or your voice notes to 0703 1756 537 or 08155 917 917. Our radio doctor this morning is Dr. of ROA Specialist Hospital. Good morning, Dr.
Good morning. Good morning. Thanks for having. Good morning. Thanks for having me.
It's good to see you. Dr. Abiola, I'm giving you side eye because we had first of all, let me say thank you first for for the free consultation for the Children's Day last Wednesday. ROA especially came. You're one of our sponsors, and parents and kids, if you check their weight, their height, their weight, whatever. So thank you for that. For me, I'm not giving you side eye because I thought I was gonna see you.
Oh, yeah. I have a personal matter that I'm dealing with. That's why I missed the radio on Friday, and why you didn't see me there. So I'm sorry. I was also hoping to see you guys. Sorry about that.
Okay. It's okay, so good. But thank you. The people who came, I cracked them up so much because I went on the scale and I told them that your scale is wrong, Dr. Viola. Let me just tell you.
Oh my
the scale that they brought is wrong. I told them you need to go take because the number that he gave me was a wrong number. It was a very, very wrong number. Like I know that I done rubbish. No. Actually, a week before then, I checked my weight and it was really, really good. I was so happy. But then, in my usual fashion, whenever I see a good number on the scale, I celebrate. And the celebration must have gone.
How do you celebrate? Is the problem?
Yeah, well, I celebrated to say, oh my gosh, look at my oh my gosh, such a great time to be alive and all of that. I knew I did rubbish. But what do you mean I added 10 kg in a week? That was crazy. So I said to them, and I told them to tell you, I said, you people's scale is bad and I don't agree with this number. And lo and behold, I did check my weight somewhere else and it was a different one. So go and check your scale, Dr. Viola. Let me just say it now.
No problem.
Good. Okay, we're gonna get into it this morning. We're talking about hematuria, right? That's the topic for this morning. So, Dr. Viola, what exactly is hematuria? And before I go to my second question, yes.
Yeah. So. Very simply, hematuria means blood in the urine. So it can be visible where the urine looks red, it can look pinkish, it can look brown, it can even look like tea, like Lipton tea. So we have something called gross hematuria, which is you can see it with your not gross that it's disgusting, gross that you can see it, like with your eye. And then we have something called microscopic hematuria, where there's still blood in the urine, but the urine looks normal, but there's some red blood cells in there that can be seen on almost over 400 million UTI cases reported worldwide. And sometimes hematuria can be a sign of UTI, very, very common. And everyone should know blood in the urine is not normal because bleeding can come from your kidney, your bladder, prostate, or even your urethra. So that's the main thing. Hematuria is blood in the urine, and we should get it as a warning sign of other things. And I'm sure we'll talk about that as we go on.
Okay. So why is blood in urine never normal? I mean, it seems like a no-brainer, but medically, it's not normal.
Yeah, that's exactly it. So, for example, the average patient that has blood in the urine, they'll maybe see one episode of blood in the urine instead of going to meet their doctor or going to get that checked out, they'll watch. If the next one is not bloody, and they go to sleep and wake up and it's not bloody, they'll say, that was just something that happened, which is no. I'm telling you, majority of patients, that's what they do. They'll see it once, it goes away quickly, and they just ignore it. And that's what we're here to stress: is that blood is not normal, and it could be a sign of something else. And our theme, anytime we're talking about a medical topic, you and I with WFM, is that every disease is easier treated at the beginning than in the middle or at the end. It's always beneficial for you to be ahead of something than to wait. So if you see an early warning sign, God forbid it's cancer, and you can live a normal life, but you ignore it, the cancer spreads to other places, and by the time we get involved, it's now spread everywhere. Then we have a different conversation. We now start measuring your life expectancy in months, not in years.
Okay. So in Nigeria now, what are the most common causes of blood in urine that you have seen?
The number one cause is urinary tract infection. That's why I gave that statistic of over 400 million people, or over 400 million infections, UTIs, worldwide. So it's a very common thing. The second most common would be kidney stones. So somebody that has kidney stones or bladder stones. And keeping going. So we're going down how I remember it, would go down the pathology anatomy. So start with the bladder. Beneath the bladder is the prostate. So prostate enlargement, prostate infection, even prostate cancer can cause blood in the urine. And of course, if you have an accident, so if somebody had like a car accident, they have a lap belt and they injured their pelvis. So that's I've had that happen. I've had that come in. I had a patient with came from a road traffic accident. He's not talking very much. You're trying to make an assessment, right? And now catheterize and put a tube into the bladder to drain the urine, and you now see blood in the urine. The doctors around me didn't really think that of anything. I jumped. I said, no. This means that he possibly has broken his pelvis. And, that big, one of the largest bones in your body. And he needs now urgent CT. So we sent him for a special scan, and yes, lo and behold, his pelvis was fractured. So that's the main thing, but it's very common to see, and it's also very common for people to ignore it. And we're going to change that today.
Okay. All right. So how can a how can a patient tell if the blood is coming from the kidney, the ureter, the bladder, prostate, or the urethra? Hi, Dr. Biela.
Yeah, patients won't really know where it's coming from. It's not always, but sometimes the symptoms, you can have some symptoms.
Okay.
So if you're, we talked about kidney stones causing blood in the urine. So if you feel flank, they call it flank. It's on your lower back on either side. So if you feel pain on that side or on that side, that could be a sign. If we're also thinking about stones, or we're thinking about urinary tract infection, burning with urination, we call that dysuria. So if you have burning with urination, think about it. If you have a simple urinary tract infection, that, when I say simple, it's just affected your bladder, it will start. You'll have symptoms of frequency, meaning you want to urinate more often. Nocturia, you wake up in the night to urinate more often, or dysuria, which is burning sensation when you urinate. So that's urinary tract infection. If you ignore that and the infection now continues up, it can now go up into your kidneys. You now have something called pyelonephritis. That's a lot more serious. Continue to ignore that, the infection now enters your blood and you become septic. Somebody's septic, fever, they can go into a coma, you could collapse, these kind of things. So that's the common theme, that you may not know exactly where it's coming from, but symptoms will give you clues, and take those clues to your medical professional.
Okay. So some women see blood in their urine as a result of, periods. Is that a cause for concern, or you just rule those ones out?
No, it's you can have heavy exercise can cause blood in the urine, menstruation can contaminate urine and cause it, and I see that often. So what I normally do if I have a woman that now have what we call a urinalysis, that's a urine study, and I see blood in the urine, one of the first questions I'm going to ask you, when was your last menstrual period? If she now says anything close to the day we're talking, I'll say, okay,
Mm-hmm.
I'll see you in 2 weeks and we'll check it, 1 to 2 weeks, and we'll check it again. I'm not going to get too alarmed because oftentimes menstruation can contaminate the sample or affect the sample. So after the menstrues, then there's a way you can collect urine where you start urinating first, and then in the middle of your stream is where you now take the sample. That's also another way around it. But if blood is still present a week or two later, then we're going to investigate fully.
Right, right. Got you. Okay. So, what kind of exams are done to help to differentiate UTIs from kidney stones from prostate issues to bladder cancer?
Um, well, when I first see the patient, of course, you're going to ask history, ask questions, and then
Mm-hmm.
during the exam, I'm going to palpate or press different areas. So what I usually use is I use my fist and I'll pound, not too hard. I'm not trying to injure anybody, but I'll pound the flank, which is the lower back on either side of the spinal cord,
Okay.
right? So I'll pound that. If somebody has a stone, kidney stone, or what you call pyelonephritis, which is infection of the kidney, usually they'll have pain when you do that. And the more severe it is, the more severe the pain. So I've done that before, and a person jumped, almost jumped out of the chair, and later on down the road, we found out that she had a kidney stone. The
Hmm.
another one is over the bladder. So if I push your belly over the bladder, you shouldn't complain about anything. But I do that now, and I get pain. You get pain right where when I'm pushing. It could mean that you have something called cystitis or irritation of the bladder or urinary tract infection, anything that affects the bladder. If you push that and you have pain. Um, for the part of the physical exam, because you said, what kind of things can you examine? Temperature. So if somebody has a urinary tract infection that's bad, or a kidney infection that's bad, they can have a fever. So we'll also check their temperature.
Okay. 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 Because all of them, the symptoms can mirror each other, right? Is why you need to do
Very
this.
Yeah. So it's called a urinary tract, right? So it's like you can consider like a train track. Everything goes straight. So from your blood, it goes to your kidney. From your kidney, it goes to your bladder. From your bladder, it goes outside. And in between each of those organs, there are tubes. So between the kidney and the bladder, there's something called a ureter, long tube. Between the bladder and outside, there's something called urethra. So anywhere
Mm.
along that track, anywhere along that train track, if you have an issue, can show you blood at the end of the road, at the end of the station. So your
Mm.
last train stop or your last bus stop could be blood, right? But it could have happened anywhere before then. So in the ureter, urethra, bladder, kidney, it's all together. It's all one track.
Okay. So when should a general practitioner, a doctor, then refer a patient with hematuria to a urologist?
Somebody like me, you're gonna
Yeah, somebody
refer,
like you.
you're gonna refer urgently. You're gonna refer urgently if you have gross
Right.
hematuria. So if you can see blood in the urine, that's a very good reason.
So it's
Um,
immediate.
who's the midget?
I'm saying it's
So,
immediately the doctor should do that, right?
oh yes, exactly. If you see
Okay.
blood, and important to know if it's painless or painful, both of them should be. Because some people think that if it's painless, you can ignore it, which is not true.
Mm.
If a GP sees a patient come back with recurrent blood, so you have a lady, she had blood in the urine in January, you did some treatment, in February she's back, or in April she's back, you see those kind of things, yes, now keep that up to the specialist. Anybody that has also, we're talking about when the GP should refer. if you do a test called PSA, we've talked about PSA on this show,
Mm-hmm.
prostate specific antigen for men, and we use it to kind of assess your prostate cancer risk. So if you have a normal prostate exam or you have an elevated PSA, then kick that to the specialist as well. And then well, I'll add one more. Somebody with severe pain or severe fever or
Okay.
high fever too, it may mean that it's a little bit more serious than a regular GP.
Okay. All right. All right. All right. So my next question for you is, so what are the basic tests that should be done for the patients, the patient that has, blood in their urine?
Yep. A quick thing. People take urination for granted until there's a problem, right?
Yeah.
That's it. We all just take it for granted. Oh, I need to pee. I go pee. After you finish peeing, it's off your mind. But the
Mm-hmm.
day you have a problem with your urinary tract, things can be
Very
very,
true.
very
Very
different.
true.
For men, especially some older men, they can go into something called urinary retention, where you're pressed, you want to pee, you go there, nothing comes out. That is one of the most painful experiences because your kidneys are still making urine, pushing into your bladder. Your bladder is still trying to stretch and stretch and stretch. And if you have ever held your urine for so long, you know that can be painful. But in the former situation, you can go and urinate and release the pressure. In retention, you can't. So you need a doctor to either put a tube or to pass a catheter. So anyway, you were talking about the test that GPs should order.
Yeah.
Urinalysis. So urinalysis is put your urine in a cup, and not a drinking cup. We have special cups for urine, right? So you put a urine cup, and there's a dipstick that the lab will put in there, and you're looking for things like white blood cells, red blood
Mm-hmm.
cells, and protein. Then there's something called a urine culture. So we'll take that culture and try and see what kind of bacteria grow in it. And an interesting fact: normally urine is sterile. Normally urine, has no bacteria in it when it comes out of your body. That's how it's supposed to be. I remember reading a National Geographic article about the earthquake in Mexico, where a building fell. One building fell on the man, and he survived for, I don't know, was it 5 days? Well, drinking his own urine. He found he cushioned, the foam from a chair that was, he was trapped. He couldn't move, but he would now urinate on that foam and then squeeze the foam into his mouth, and that was how he survived. Oh yeah, oh yeah. That's I don't recommend anybody drink urine, but if you have a building on top of you and there's no water around, then maybe. The problem is, and other people stranded in the wilderness. I've read those kind of stories too, where they're stuck, no clean, they drink water, and they end up drinking urine. The thing about it is your urine is concentrated toxins, right? So each time you drink it, it just becomes more and more concentrated. So it's not something that you can do for any length of time. But I thought I would gross you out by saying
I'm still stuck on the person that is peeing,
that.
is drinking his pee. Ugh, yuck.
Right?
Okay.
I can't imagine. Just try and imagine the time, the period of time when you now have to make that decision. Like, okay, it's been 3 days. I'm dying of. I'm going to start drinking my pee. When do you make that decision, and when do you take that first drop? So anyway,
This is shy.
that's interesting. So we said urinalysis, urine culture. We do a blood test called full blood count, looking for excess white blood cells. There's a blood test that we can do to check your kidney function. So these are still tests that GPs should be able to run. And for women, especially pregnancy test is important. And for men, PSA, prostate specific antigen is also important. And then besides those blood tests and urine tests, then now imaging. So ultrasound or sometimes CT scans are useful in some patients. And then send all of that to the urologist.
Okay. This is well. Okay. So what symptoms do you notice that makes you is it differentiate between whether it is bladder or prostate cancer over UTIs? Like, what are the, or are they just so similar that is there a unicorn there that tells you, oh, this is the one that tells you that this is this?
Between which and which? Sorry, I didn't catch.
Bladder, prostate cancer over a UTI.
Yeah, so some of the symptoms overlap, but when we talk about UTI, you'll have a burning sensation, frequency, which is just during the day you're going more often. You can have cloudy urine, and you can have lower abdominal pain. In prostate issue, you could have all of that, right? On top of a weak stream. So your urine stream is not as strong as it used to be, or you feel like you're straining. Or one very big good sign is you urinate, and then maybe a few minutes later you have to go back to empty the rest. These are all signs that those are signs of prostate. So it's difficult for a patient to just analyze the symptoms and know which one is which. But in the office, we can usually do a few things to try and rule them out. But I keep reminding that it's a tract. So things up the tract can affect things down the tract and vice versa.
Okay. So what is the role of urine microscopy, culture, PSA, and ultrasound in your initial workup?
All of those are very useful. So urine microscopy is putting the urine under a microscope, and you're looking for things like red blood cells. You can look for white blood cells. You can look for crystals and different proteins. So these crystals are usually associated with stones, whether they're kidney stones or bladder stones. Another test we do, urine culture. So the reason why it's important to culture the urine is because you need to know what bacteria is causing the infection, because urinary tract infection can be caused by 1,000 different things. So you want to know what it is. You also want to know what antibiotics will work best for that infection. So that's why a culture is useful. I see a lot of doctors, they'll have a patient that has dysuria, burning with urination, frequency. They touch the belly, the patient has some pain, what they call suprapubic pain or pain above the bladder, and they make the correct diagnosis of a UTI. And then they now just pick their favorite antibiotic and give to the patient. There's a step missing in there, which is the urine culture, because sometimes the patient will go take that medication, the bacteria that you're trying to treat resistant, so the infection just keeps getting worse. It gets worse, it now goes to the kidney, and the patient now comes back septic, blood, the infection is in the blood. You say, but I've been on antibiotics. Yeah, you've been on antibiotics, but you've been on the wrong ones, right? Your doctor didn't order cultures, he didn't check sensitivities, and that's where we are. So the culture is extremely important. You mentioned PSA. What's the role of PSA? And that's something we talk about almost all the time. Prostate specific antigen, meaning something that comes just only from the prostate, and we use the levels of that in your blood to give us an idea of your prostate cancer risk. PSA can go up because of prostate cancer. It can go up because of prostate infection. It's called prostatitis. But I mainly use it to establish somebody's prostate cancer risk. The higher the PSA, the higher the risk of prostate cancer. And the last one I'll talk about is ultrasound. Ultrasound is useful, but you have to be very careful that a normal ultrasound does not rule out UTI, bladder cancer, or stones. A normal ultrasound does not mean everything is fine, because not all stones show up on ultrasound, and you cannot see bacteria, on ultrasound as well. So just because you did it normal and your scan is normal doesn't mean everything is normal. It just means that they didn't see it. They didn't see anything.
Okay. I suppose because every time you want to go do, maybe there's a problem, they must do that ultrasound, they must do that culture, whatever it is. Those two, so basically, those two are how you know what's going on internally, right?
Yeah, very, very, very. Yeah, with those two are the main ones.
Okay. So let's move to kidney stones. What are the common signs that a kidney stone is the cause, right? And how do you manage that pain for the person?
Yeah. If you think that it's a kidney stone, you're going to have, the first thing that usually brings people into the office is flank pain. So that's pain on the sides, right? Um, they can also have frequency. They can also have hematuria frequency with using the urinating very frequently. So usually people during the day they urinate every 3 to 4 hours, max. But I'll see some patients that urinate every hour. In some severe or moderate to severe prostate disease, I have some patients that urinate every 20 minutes. Right?
Mm.
I've seen that as well. But kidney stones will usually give you pain, and then you may also have on top of that um, you know, how would I say it? All the signs of having that stone. So nausea, the pain, nausea. You can have nausea. You can even have vomiting, and you can also have blood in the urine from a kidney stone.
Okay. Okay. So when is imaging mandatory for suspected kidney stones? Or what's the first line of action when you see suspected kidney stones?
Yeah. So, well, and then I didn't give the statistic. It's estimated that 1 in 10 or 1 in 11 people may have how would I say, have the risk of developing a kidney stone or will
So
develop a
it's not
kidney stone in
gender
their lifetime.
specific.
One in 11 will develop a kidney stone in their lifetime. In some areas, like in the States, that's the current statistic. I don't know the one for Nigeria, but it just shows that it's a common it's very, very common. One thing that we do, I know you asked a question, but one thing that we do a lot in Nigeria, which can increase your risk of kidney stone, is suffering from dehydration or fasting. So, I have some people that fast, you know, dry fast, not drinking any water, not doing and you're obviously going to
Because God
dehydrate
has
your
to
body.
answer the prayer.
Yes, because God wants you to put yourself through misery to show him that you're faithful, right?
God
That's
must
that's
answer the
that's what
prayer. Miss Fabiola,
that's what
please.
God can answer your prayers. It doesn't mean you have to halfway kill yourself on the way to it. I think
Yes.
God listens. In my opinion, I'm not going to turn this into a religious thing, but in my opinion, I feel God can hear me whispering in my bedroom, well fed, the same way He can hear me
Well fed.
shouting, well fed. It's He can hear me the same way when I'm well fed as when I'm starving to death. I believe that. So, and when I want to sacrifice for the Lord and others, I do good works. So I'll do free medical care. I'll do outreach. I do shows like this. So, um, I believe that God and I are on the right side. We'll
Me,
find
I'm
we'll
not
find out
good,
when
I
I
don't.
die. We'll find out on Judgment Day.
Yeah, I don't. I mean, I'm not good. I cannot tell you.
Remind me of the question that I want to make sure.
My
You talk
question
about
was
imaging.
yes. I, God wants me to be well fed. Wow, wow, wow. I didn't see that one coming. I
Yes.
was asking that what are the most common signs that kidney stone is the cause, and how do you manage the pain for the patients?
Yeah. So the signs again: flank pain, blood in the urine, urinary frequency. We manage the pain. I'll give strong pain relief, especially if I know what's causing it. I don't play with patients having pain, and some doctors have different philosophies. If a patient has pain and I know why they have pain, they have a stone or they broke a bone or something, I'll give them as much pain medication as I can without compromising their health, right? But
Mhm.
I would rather that patient not be in pain because they're suffering through something. Just constant pain can also cause you mental stress, increase stress hormones, and cause problems elsewhere. So I don't play with pain. So I usually give strong pain relief, and some people may need anti-vomiting medication, right? And those are the two things. And then we'll start doing our culture. If it's very serious, I may start that person on antibiotics right away while I'm waiting for the culture results. And then next is tests and imaging. imaging is important, especially when you're thinking about stones, or you're worried about stones.
Okay. I have is our kidney stones, are they gender specific? I think it's how is it gender specific?
That's an excellent question. And no, I see stones in women, men and women about the same. So it's both men and women are at risk for not only the kidney and bladder stones, but the same thing as bladder cancer as
Right.
well. It's only prostate cancer that women get to escape from because women don't have prostates.
Right. Okay. Okay. All right. So for bladder cancer, for instance, what are the early warning signs that GPs mostly miss when it comes to bladder cancer?
So and I just had a case. The guy is 25 years old. And the good thing about him is that for some reason, he's very sensitive to his body. So if he has a fever, he's not going to just go to the chemist and take some drugs. He's going to go and check and do a blood test and anything. So one day
Oh,
he had, yeah, he's, you don't find too many young people like that, but it
no.
was, it's, I still call him one of my best patients. So one day he had painless, visible hematuria. So looked, finished urinating, looked in the bowl and saw blood, but didn't have any pain, didn't feel any kind of way. That was the only symptom. The next day, the blood was gone. Instead of him ignoring it, he started researching, and somehow he found me, and we started to work up. So of course, the first thing that I would think about is urinary tract infection. So I started looking for a urinary tract infection. Didn't see that, um, and then I started digging deeper. Thank God I didn't narrow this to age and say that, oh, he's too young, because a lot of doctors do that. He's too young to have cancer. I'm not going to even look for it. you know. So I did something called cytology, where you collect the urine and you look at those cells, the cells that are in the urine under the microscope. And lo and behold, we saw some what you call dysplastic cells, cells that don't look normal. They look like cancer cells, or because cancer cells have a unique look, and even precancerous cells have a unique look. So that's what we're seeing. So I now did something called cystoscopy, which is because I want to find out, where did these cancer cells come from, right? Is there a tumor in the bladder, something growing in the bladder, something prostate? We don't know. So took a camera and put a camera through the urethra, into the penis, past the prostate, into the bladder, and look around. And I saw something hanging on the top of the bladder, a growth, right? It looked like fingers, like this, growing on the top. I have an instrument that has a wire loop, there's a laser, so scraped those things out, and I made sure I got everything, and took a little bit extra of the normal tissue. You do that to make sure you get everything, and we now send that for histology, meaning a pathologist will prepare it and look under the microscope and tell us doctors what's there, and it was cancer, what we call transitional cell carcinoma, TCC, yes, or some call it urothelial cancer, but it was cancer. So the good news is that this particular story happened maybe 5, 6 years ago, and since then the guy comes maybe every 6 to 12 months for a checkup, and he's been cancer free since. I did have to do there's a type of chemo that doesn't go in the blood; they put into the urine itself. So I did that for him for about 6 weeks at that time, and we just repeat that same test that we used to diagnose the UTI, which is cytology, looking at the urine under the microscope. We repeat that every 6 to 12 months, and so far it's been negative. So that's a great story. So you can see how things can really happen in the real world.
That's interesting that like he didn't wait. It wasn't a case of maybe he had pain or whatever. It was that it was painless. And then wow, okay. You're still tuned to Women Radio 91.7 FM. This is Radio Doctor. We've been speaking with the MD CEO of RA Specialist Hospital, Dr. Abiola Ajayi, on Wow. On bladder wow, I'm just like I'm sorry, that was a miracle. That's all I can say. That's all I can say because
I,
I'm
as the doctor, I feel like it was miraculous.
yeah,
It's one of my proudest moments was catching a bladder cancer in a 25-year-old. That's
yeah.
I have to say I
Wow.
had to pat
So
myself on
yeah.
the back for
Amazing, amazing. So we've
that.
been talking about blood in urine, UTI, stones, kidney stones, prostate, or even bladder cancer. And why I'm a bit flustered is because Dr. Abiola just, talked about. Wow, 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 wow. Okay, 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 okay. Interesting. I mean, I'm glad for him, and to think that he comes even regularly to check. Because most people were like, "Yeah, God has delivered me. I'm not checking anymore." Things like that. So yeah, that's amazing.
That's
Okay.
that. Yes, that happens, and when it does happen, it's sad. It happened with prostate too. Had a patient I saw 20, let's say 2015, diagnosed with high PSA. PSA was maybe 90. PSA should not be higher than 4. Right?
Mm-hmm.
His PSA was almost 100. And
Yee.
so I ordered some imaging tests and this and that. Never saw him again. Now, so that's 2014. Now in 2022, which is 8 years later, he now shows up. PSA is unreadable. So if it's too so high, the machine will just give you a number greater than 1,000. It will just say that, and it won't go to 5,000, 6,000. It will just say great, and that's where his was. His PSA was off the chart,
It had
and
moved from
now
almost 100 to almost a
almost
thousand.
100 to yes, to over 1,000. So, and we're talking about something that should not be higher than one, two, three,
Three,
four. It should not be
four.
higher than 4. So, and then now he's complaining about back pain. In fact, he came in the wheelchair because he said he can walk, but the pain is so much in his back and in his hips that he prefers using the wheelchair to get around. So I now did some tests, and this time I said, please come back so we can review the results. And lo and behold, yes, prostate cancer, and the prostate cancer has spread to all the bones of the pelvis, the bones of the hip, to the bones of the back, and it looks like holes in the bone. So when you hold up the image, it looks like the bone, like bugs or something went to eat out little holes, and those are all signs of all cancer cells. So if you were to actually go to the bone and take out one of those areas, you would find prostate cancer in the bone, not bone cancer,
Wow.
which is very interesting. So I used to, before I became a consultant, I used to think that, oh, when cancer spreads, it now becomes cancer of that. So prostate cancer spreads to the bone and now becomes bone cancer, right? But it's not true. It's still prostate cancer. You can look at it, which is a good thing because whatever treatment you do for prostate cancer will affect all of those areas as well. But this is somebody that 8 years ago had prostate cancer. Then, if we have removed the prostate, that would have cured his cancer, right? He wouldn't have it.
So
But
he
they ignored
already
it.
had prostate then.
Yeah, he had prostate enlargement. Then when he came to see me with that PSA of almost 100, that was when the prostate cancer was starting, right? But he didn't come back for the test. So there's a test called biopsy where you take samples of the prostate looking for the actual cancer. Because I have a few patients, very narrow patient population of elevated PSA, of done biopsy, cannot find any cancer. I have a few of them like that, and I usually just rebiopsy them periodically. But he had all the reason for biopsy. He ignored that, and very shortly, cancer now started spreading. We'll finish with the prostate, and from the prostate go to the bladder. From the bladder, just keeps moving until you stop it.
Interesting. So it's possible for the cancer. So the cancer was in his body for 8 years and he was okay, or was he managing it?
He wasn't okay. He was ignoring the symptoms, because he can't go from walking to wheelchair without feeling something in
He would
between.
have gone through a process, obviously.
Yeah, and then that kind of person would just use painkillers. Just go to the chemist, give me something, and just keep asking for something stronger and stronger and stronger until it doesn't work. When the pain is excruciating enough and the painkillers don't work, then this kind of person now finds their way to my office. And I don't turn away any patients, but those kind of cases are depressing because metastatic cancer that has spread, I know that person is not going to live long. You know, it's not me cursing them. That's just how the disease goes. And most of those patients that I get in that situation, within 6 to 12 months, they're gone from this
Yeah,
world.
fine.
They're dead.
So in the case
No,
of
within 6 to 12 months, they're dead.
wow, so in the case of a
Yeah.
young guy with the bladder
Mhm.
cancer, you would say that that was you managing his care, right? Because he came to a specialist.
Came to the specialist with a specialist complaint. Painless
Ah.
hematuria, right? Painless
So he
hematuria.
didn't know,
But
but he didn't know that it was hematuria. All he knew was that he saw urine in his, he saw blood in
he
his
saw
urine.
blood in his urine. That's it. So,
But he,
it's a tech guy. I think he designs the websites or something. So he went online and started Googling what that means. And smart of him, he started Googling what type of doctor is the best for this. Then he now went
right,
online searching for that type of doctor, and he found ROA, and I was just there at the right
yeah.
time.
Amazing, amazing, amazing. Okay, before we go, so how do you explain the possible causes of possible causes to a worried patient without causing unnecessary panic for them?
The I'm very careful not to use that word cancer at the beginning because
Right.
once you say the word cancer, I can watch a patient's eyes and their face. After that word cancer, everything goes off. Like they're no longer listening. Their mind is just racing, spiraling out of control about what all of that means. And I may have said, I don't think you have cancer, but they just hear the word cancer and start going. So I try and keep that I try and reserve using that term. I would tell a person blood in your urine can have many causes, and some of those causes are simple, like an infection, or a kidney stone. It's not all kidney or it's bladder or kidney stone. It's not all stones you have to operate on. Some of them you can dissolve with drugs. Some of them your body will push out, right? So, but in some cases you have more serious issues, prostate, bladder, or kidney disease. So we are not
Mm,
saying, I'm looking at a patient, I'm not saying you have cancer, but I must investigate properly so I don't miss anything important. And
okay.
usually by the time I put it that way, I'll get cooperation.
Right, 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 right. Finally, before we go, what lifestyle or preventive advice would you give to patients with recurrent UTIs or stones?
Yeah, for example, now recurrent UTI or stone. So usually I'll use a woman's example for because we're
Okay.
on WFM, right? A woman that gets recurrent UTIs, oftentimes I'll now ask, does it usually happen after sex or the day after or 2 days after sex? Most of them will say yes, right? So lifestyle change is after sex, go and urinate immediately. Don't just wait. That urinating immediately after sex will now flush out some of those bacteria.
Right.
I have no problem with cranberry juice. There's a myth that cranberry juice can help.
Yeah, yeah.
Yeah, and I believe I don't drink gallons of it, but I believe that it does. It acidifies your urine a little bit, and it helps with bacteria. It's not a treatment for UTI, but it can prevent the UTI from getting
Oh,
worse. Yeah,
okay.
so those are some of the things
Okay.
I tell people.
Great, great, great. Thank you so much, Dr. Abiola, for coming on the show today. I mean, I learned some things like I should not take my health for granted any longer. But yeah, thank you so much for coming on the program today, Radio Doctor. We can reach, how can we reach Dr. Abiola?
You can reach me on socials, ROA Specialist Hospital.
Mhm.
Website is the ROA hospital.com. And of course, you can call me 0913-579-5108.
Dr. Abiola, this is your personal
0913
number, Abby.
Yeah, that's my personal number. I'm not
So
afraid
why
to
are
give
you
it up.
giving your personal number out like that?
I'm not
You're so
afraid. I'm not afraid.
you're not a Nigerian, that's what I can say.
I'm not afraid. If a patient really needs help, I would rather them just get to me directly. So
Mhm.
that's my personal number, and
Right.
the hospital number is 080 888-62635. If you want to talk to a
Yes.
doctor other than me.
Yes. I'm sure everybody wants to talk to you anyway. They're like, oh, the Oyinbo doctor, let's talk to him. Thank you.
That's how it is.
Thank you so much, Dr. Bella, for coming on the show today. Enjoy the rest of your day and have a great weekend as well. See you next week.
Have a good weekend. Cheers.
All right. You're still tuned to Women Radio 91.7 FM. And we just finished Radio Doctor. Catch us on Monday for another edition because Radio Doctor happens Mondays through Fridays, 10 a.m. to 11 a.m. Don't go anywhere. This is the Women Radio 91.7. We have great programming for you, great music to also keep you company. My name is Fumi Bangola signing out. See you later.